Welcome to this episode of Thrive With Us. Today I will be chatting with Dr. Lara Ferresi, a specialist psychiatrist at Thrive Wellbeing Center. She completed her psychiatry training at the University of Pisa in Italy. And today we're going to be talking about something that she and all of us have been observing more and more. And that is this concept of a palliative society. So people turning towards consumption of various things to ease their pain and suffering. Welcome, Lara.
Hello, good morning. Thank you, Sarah.
So before we start, I mentioned that you are a specialist psychiatrist. A lot of people are not quite sure of the difference between psychiatry and psychotherapy. Can you explain a little bit about what a psychiatrist is and what a psychiatrist does?
Yes. So I also had the same issue in my consultation, but psychiatry is a brand of medicine. So you study medicine and you study how to assess, how to diagnose mental health problems. And the most important difference is that you can't prescribe medication. Psychologists, you study psychology and then you specialize in different kind of psychotherapies and you cannot prescribe medication. So this is the main difference between psychiatry and psychology.
Thank you for clarifying that. And I think one important thing to mention as well is that psychiatrists and psychotherapists, psychologists can work hand in hand. So you can start with doing the initial evaluation and diagnosis and help with the treatment planning, which can include medication, but that's not required and it's always the patient's choice. And then a psychologist can assist with psychotherapy and you can work together to kind of manage the client or the patient's needs from both angles.
Yeah, exactly. Yes, because so many patients, they are worried about starting on medications because they fear the side effects or if they are going to change their personality. So sometimes I do the first assessment and then I refer to a psychotherapist.
Okay, great. Thank you for clarifying that.
You're welcome.
So now let's dive into the topic today. So when you and I were chatting about what to discuss, you came up with this idea of the Palliative Society. I mentioned very briefly at the beginning of the episode what that means, but maybe just define it for us and share a little bit your observations, what you've been noticing in your clinical practice.
Okay, so I came up with this idea because since I started working in Italy and also in Colombia, I started noticing this fear of pain, of emotional pain. So to begin with, Palliative Society is it's a society that prioritizes avoiding rather than confronting or addressing emotional pain or emotional challenges, anxiety, sadness. And the society doesn't go through this pain. They try to avoid it through different distractions like substance use, like drugs or social media, working a lot, in this society that cannot accept negative thoughts.
So what I'm hearing from you is that you've observed on a large scale that many people are experiencing so-called negative emotions like anger or sadness or fear or anxiety. And for some people, those emotions are really scary and need to be avoided. And rather than addressing, processing, working through those emotions, what people are doing is distracting themselves. And they distract themselves through substance use, like you mentioned, such as drugs and alcohol. They distract themselves through really intense social media consumption. They throw themselves into work, which I imagine probably is the most adaptive out of all of those things.
The third one.
Like if I'm super anxious and I don't want to deal with it, well, working 15 hours a day is going to help me escape from that.
Yeah, escape from that, yes. And also to not have contact with those thoughts, because sometimes they are scary, but also they overwhelm you, and you don't know how to manage these thoughts. So it's better to escape from those feelings and those thoughts. So yeah.
So you escape from it, and something like substance use or excessive scrolling on social media, we know and we've heard that that can be really bad for you in a lot of different ways, right? Physical health, mental health, all of that, your social relationships. But with working, if you're working 15, 16 hours a day, let's say, you're probably going to be performing pretty well, and you're probably going to be reinforced for that.
Yes, that is true, but also like your physical level, like it will not. Your body one day will say, "No, I can't handle it anymore," and then you will become depressed. You know, so we have to be really careful with this excessive working and.
Yeah. So at the beginning, it might be adaptive. It might be something that gets reinforced with your workplace and maybe in the society more broadly. But what I'm hearing from you is our bodies, they're not meant to have all of that for so long. And eventually there's a crash.
There is a crash. Yeah, exactly. So that's the risk.
Okay.
There is always a risk, a long term. Also with drugs, it's very risky in the long term. Also with social media, because when you scroll all the time for 15 minutes, that becomes 3 hours. Like also your concentration levels start getting damaged.
Yeah, absolutely. Okay, so we talked about work, we talked about social media, we talked about substance use. What about eating? Shifts in eating behaviors. Is that something you've also observed that people do?
Yes. When they feel some kind of void or emptiness, the first coping mechanism is to binge. To binge like different kind of food, of course sweet, chocolate, but sometimes also random things that they find from the fridge. So that is also dangerous, because if you have a really big binge eating, you can end up having digestive issues.
Okay.
So yeah, it's
Okay, so what I'm hearing from you is that the tendency to cope with food usually comes in the form of binge eating.
Yes.
And binge eating is one of the eating disorders as classified in the DSM. I think it's the newest one that was added, or one of the newer ones.
yes.
Can you walk us through what binge eating disorder means and what it looks like? What are some of the symptoms? Because I think everybody has probably binged at one point in time or another. So when does it kind of veer into the territory of a problem or a disorder rather than a one-off?
Yeah, so the main difference is also the intensity and also the frequency.
Okay.
So it normally happens when the person feels really sad or some kind of emptiness inside of them, that they don't know how to cope with that emotion, that situation. So they learn to cope with food. So they start eating a lot, like maybe in 1 hour they eat like, I don't know, 5,000 kilocalories, which is a lot. And after that, they usually feel very guilty. They feel worse than before. So there is also a risk of becoming a cycle. So it's important in that moment to start talking about their feelings, why are they feeling like that, and start like a really important psychotherapy.
So this is interesting because you mentioned at the beginning of this episode in our conversation that you're noticing people are turning to these distractions as a way to cope with negative emotions. What I'm hearing from you now is when people engage in binge eating, they're not escaping those emotions.
Exactly, they are not escaping. Like in a short term, they think they are escaping, but if you don't address the underlying illness, it will keep repeating and in a worse way. So that is the risk. Like, people believe in a short term distractions might help, but in a long term, it's just gonna worsen it.
Okay. So in the moment when I'm eating that pint of ice cream,
Yes.
I might have some sort of temporary relief or boost or distraction, but because it's binging, it means that the quantity and the frequency is a lot.
It's a lot.
Afterwards, I feel really bad about it, right?
Yes.
And so that's just going to add to probably the intensity of the feelings. Do people then binge again and then kind of the cycle perpetuates?
Yes, that's what happens. That's why people who suffer from binge eating disorder, they really have a very, very high weight, like overweight. So that's why in a physical way it's also dangerous for your health.
Okay. So it doesn't actually provide any relief for the negative emotions. So emotionally, psychologically, it's problematic. And then you're saying as well that there's a physical toll because of the excess intake of calories. And usually I would imagine, I've personally never heard of anybody binging on anything healthy like salad or avocado. It's
Me
usually
neither.
something very like carby and sugar laden, which makes sense because it kind of helps giving that boost.
Yes.
And so the digestive issues you mentioned at the beginning,
The
as well as a weight increase,
Yes.
which is not about the physical appearance, but excess weight, obesity contributes to so many other illnesses.
Yes, like diabetes or hypertension. I remember in Italy, I was following a girl who was 35 years old, and she was already suffering from diabetes and hypertension. Yeah, because she had like really, really bad binge eating episodes. So, yeah, we were trying to help her, like from both sides, from the psychiatric part and also with psychotherapy,
Okay.
which is very important in these cases.
Okay. So we talked about eating behavior, we talked about social media, we talked about escaping through work, and we talked about substances. Now, walk me through what happens when someone presents. Like you just shared a bit about a case that you had when you were working in Italy. Let's say somebody comes and they present. I would imagine they don't come and say, "Hey, doctor, I'm escaping my
escaping from
feelings."
pain.
You know, it's something you probably uncover as part of the evaluation or the review process. And so you start to notice, you know, continuing with the example of the binge eating, that this person is trying to escape and to numb themselves, but it's not really working. How do you approach that with them, and what does the way forward look like in terms of their treatment?
Okay, that is a very good question. It's not easy because sometimes these kind of patients, they also avoid talking about many emotional issues, but usually after like a few of interviews and you start like getting to know better the patient and you start understanding the coping mechanisms, you can tell that most of them are always escaping from a core belief that they have from themselves, like not feeling loved or feeling inadequate or feeling not worthy. So to have contact with those core beliefs for them is something really, really, really intolerable. So we have to walk with them through those feelings and accepting so many things. So it's not easy, but with effort and with work, we can like help them.
Okay.
Yes.
So it seems that, as is the case, I think, with anything to do with mental health, there needs to be a rapport that's established and a sense of trust and a sense of safety with the client in order for them to be able to do the work. And what I'm hearing from you is that part of the work is helping identify what it is that they're trying to do. So they're escaping, as we said at the beginning, but what are they escaping? And it sounds like what you've observed is they're escaping these very deeply held beliefs that they have about themselves that are not very nice or pleasant. I don't think anyone wants to believe that I'm not worthy, I am not
Yeah.
lovable, I am not good enough, but it's there. Where do these core beliefs come from?
Yeah, so these core beliefs, they usually come from childhood, from their parents, their like many different experiences when they were very young. So they accepted these kind of ideas and they started to learn different coping mechanisms be to feel distant from these core beliefs. But when they become adults, these mechanisms are not more are they are not helping them anymore. So they start having this contact with these core beliefs, and in that moment is when they start escaping with so many different forms.
Okay. So the core beliefs develop in childhood, and like many things, they're coming from the socializing agents. And for most of us, that's parents or, our direct caregivers. And what I've observed, I don't know if this is the same for you, but a common core belief that I see is the sense of I'm not good enough. And that can come from just hyper focus on performance.
Yes.
And for example, just to contextualize it, you have a child and they come home with a 9 out of 10 on an assignment, rather than kind of acknowledging the effort and the job well done, immediately it's to where is the deficit, right?
Exactly,
And this
yes.
focus on, well, forget about anything good that happened. What did you miss, and why were you not able to be perfect? And perfectionism and the not good enough tend to go hand in hand.
Yes, they tend to go together. Yes, but for substance use or other kind of distractions, there is always the same core belief, which is I'm not worthy or I don't deserve to be loved.
Okay.
So it's something really, really hard to cope with, and that's why they try either to numb their emotions or to escape with other kind of distractions.
I can imagine, because at the end of the day, human beings, we're social. We're social creatures, and we are meant to be part of groups for our survival and for our fulfillment. And so if your early experiences led you to believe that you're not worthy and deserving of love, then I would imagine that makes you feel very isolated and not embedded in the communities and networks that you need to thrive.
To thrive, exactly. So imagine, I mean, and they are on their own. Because many people, they don't know that they could seek for help to understand why am I feeling like this? What could I do? Is there another way of thinking? Can I have new insights? Many of them, they don't know. So that's why I also think that the podcast and different social media things, they can also help these people to knowledge that there are different ways.
Yeah, and I think this is a really important point too, because at the beginning of the episode, we said social media is one of the ways that people escape. And I think people assume when we talk about the negative effects or the negative links between social media use and other things, that we're saying social media is bad and people shouldn't utilize it. And that's not the case at all.
No.
It can be a very helpful tool for raising awareness, for educating, for connecting people. It's the excessive use though, and it's the intentionality. Like, am I picking up the phone to scroll because I want to learn about something, I want to kind of see what other people are up to, or I'm feeling something or I'm starting to feel something and I don't want to, so I just need any sort of out.
Exactly, yeah, because everything in life is about balance. So like we could scroll for 15 minutes and that's it. We can relax, like escape a little bit from our daily challenges, but I mean, one extreme, so.
Yeah, definitely. The extremes are problematic. So you were saying before that what you're seeing with substance use specifically, substance misuse, is this core belief of not being worthy, and that often comes from early childhood experiences. Does that mean that it's linked in a way to attachment styles?
Yes, it is. Yeah, it's very linked to attachment styles. It's very linked because most of them, I mean, my patients who had these problems with substance use, they had really, really difficult childhood with maybe the father was absent, and maybe the mother was very aggressive, or the mother had different boyfriends. I mean, attachment is really, really correlated with this kind of core beliefs. Yeah.
So there's some adversity within the nuclear family
Yes.
that you notice in a lot of people that struggle with substance misuse. You mentioned fathers being absent. You mentioned unstable sort of relational patterns between the parents, as well as in the case of separated, divorced, never married parents, kind of a little bit of a revolving door. So when it comes to attachment, you know, we have the secure attachment, the disorganized, the avoidant, and the insecure. I would imagine substance abuse is probably not as prevalent and securely attached, which is most people. Where do you see it happening most? With insecure, avoidant, disorganized, or is it with all three?
I would say disorganized.
Okay.
Yes.
Okay.
That is the more prevalent. Yeah.
Can you explain disorganized and how it works
Yes.
and maybe what you see as the patterns?
So in the disorganized attachment, the most prevalent thing is that mother and father, they are inconsistently present. So maybe they arrive to you and they are happy and lovely to you, but then 20 minutes later they become aggressive. So you don't know what to expect in this kind of family. So that happens to them when they grow up. They don't know what to expect from the other. Like sometimes they will treat you well, or sometimes they will become aggressive. So this is like the main issue.
Okay, so unlike the other insecure attachment styles like avoidant or anxious, it's predictably unpredictable. So
yes.
I know I'm either going to get them being super all in, or I'm going to get a different side. I have no idea which one, and it can change at any time. So I would imagine that that leaves the person feeling like they're on the edge of their seat all of the time.
All of the time, and they feel confused because why does my mother love me now, but then she hates me? Because she can be also very aggressive, she or he. They can become very aggressive and then very tender, very caring. So they also get confused.
I've seen, I don't know if it's been the same for you, but I've seen also that even in those moments when the person is tender and loving, as you described, the receiver is still anxious because even though this is really nice and I like this much more than the alternative, I know it's going to end.
It's gonna end.
And when is it going to end? And how bad is it going to be when it ends?
Yeah, so they are feeling anxious all the time and very unstable. They have a very unstable relationship stories. Like they usually start relations in a very intensive way, and then they suddenly become aggressive or caring, and they are very unstable in terms of relationships.
So with disorganized, it's like predictably unpredictable, consistently inconsistent. And you're noticing that that's really tied to the core belief of I'm not worthy and I'm not lovable. I'm guessing, correct me if I'm wrong, that maybe that comes from the idea or the thought process that, well, if I was worthy and if I was lovable, I would have this tender person in front of me all the time.
All the time.
And the fact that they switch and turn on me is not about them. It must be about me.
Yeah, it's because of me.
Oh.
So it's like a kind of confirmation. Like I don't deserve to be loved. Yeah, so it's very sad and also very hard to cope with.
Yeah. Very deep feelings of rejection, I would imagine. And then you have the core beliefs. So the core beliefs also pave the way to the negative automatic thoughts,
Yes,
right?
the bias.
Yeah. So how does that work for someone that engages in binge eating or other escape techniques?
Yeah, no, so these bias beliefs like condemns like their lives because they are continuously interpreting everything in life and everything in a negative way. So like for example, if your boss didn't say hi to you, it's because I'm not worthy to be to say hello, or it's because I didn't, everything on them. They put everything on them, and they always have this guilty feeling of everything. So it's not easy.
No, it's not, because they find themselves at the root of everything and internalize and take on all of that blame and probably shame and all of those things. So before, when we were talking about the not good enough, and I told you it's something that I see quite a lot, especially with the perfectionistic tendencies, the way that it fires off is like, again, boss sends you an email, you send maybe a presentation or a brief or something. Yeah, great, blah, blah, blah. Just one quick suggestion, XYZ. And then the person only sees the one quick suggestion,
yes.
XYZ. And the assumption is, oh my God, my boss thinks I'm a complete moron.
Yes.
I'm going to get fired.
Exactly. And then they overthink about this and they can't sleep. And then everything starts. The anxiety. So that's why it's important to go through the deep core belief and treat that.
To get to the root.
Yes.
You mentioned not being able to sleep and overthinking. So we said that people aren't presenting to you and saying, I'm numbing myself. It's something that sort of emerges. Do you often find that those engaging in these palliative behaviors have difficulty with sleeping as well as overthinking?
Yeah, most of them, they have. Because they start overthinking a lot, or like they overthink about the same situation or the same thing, and they interrupt this overthinking interferes with their sleeping patterns. So they are very correlated.
Okay, so tell us about sleeping, because I think a lot of people, especially these days, are struggling with sleeping. We said that binge eating is problematic for mental health purposes, but also has physical health implications. Talk us through sleep. What happens when someone is experiencing longer term problems with sleep?
Yeah, so I would say that 80% of my patients, they have sleeping issues. And when I treat the sleeping problem, like everything starts getting better. So sleeping, it's as important as eating. It's very important because through sleeping we rest our physical body, but also our emotions. So it's very, very important. But what I can tell you is that whenever a patient doesn't sleep, they become very, very irritable. They don't have energy to do anything. They can't concentrate. So if this keeps up for weeks or for months, they can really develop some depression or other kind of mood disorders and anxiety that has to be treated with medication.
Okay.
So it's very sensitive, the sleeping patterns. So like I advise not to drink coffee at 7 p.m., things like that.
Yeah, no, there are, I think, shifts, and because I think a lot of people worry about taking sleeping medication. And I'd imagine sometimes it's indicated, but a lot of times there are lifestyle and other techniques that you can use. I think that, obviously not a psychiatrist, but you need to also pay attention to how your body responds to certain things. You said after 7 p.m., for me, I discovered over time, I have to drink decaf after 1 o'clock.
Oh,
1
wow.
o'clock.
1 o'clock, okay.
Which is very early.
It's early, yes.
But I know many people that are close to me that can have an espresso at 5 p.m. and then take a nap after.
And take a nap, yes. I know, like in Italy, we take coffee at 9 p.m.
Yep.
So Yeah, like obviously everybody reacts in a different way, and you have to get to know your own body, so that's important. But yeah, the most important thing is not to drink coffee like in the evening time, or do a lot of exercises, or scroll on the social media for like 3 hours before going to bed, because the light stimulates your brain. And so yeah, there are so many different things that you could start doing to help with sleeping.
But it sounds like so much of the stuff is like interrelated. So people have emotional challenges or issues, and then they numb. And they numb, for example, with scrolling. And now, especially these days, a lot of the scrolling is doom scrolling. We're not even necessarily being exposed to things that are pleasant and enjoyable. We're bombarded by things that, while important to be aware of, are really, really heavy. So you're engaging in this scrolling. You've got the blue light, which is going to interfere with the sleep. Because you can't sleep, you probably continue to scroll or doom scroll, and then you find yourself sort of caught up in this cycle. How can we break this? And maybe talk to me a little bit about the interconnection of all of these things. There's like loops that we get sucked into.
Yeah, it's a loop. It's a loop. But you know, people come to our consultations when they already feel depressed. So yeah, because if the person who had all this overthinking and then had difficulty sleeping and everything, that could have been stopped if she like had like a moment with herself to identify, okay, why am I feeling like this? What can I do? Maybe should I talk to a friend, or maybe my friend could advise me to take, I don't know. So it's important to have moments with ourselves, like a self-reflection on what is happening to me, why am I feeling like this, and what can I do? Because nowadays you can seek for help easily. Like this mental health well-being, it's very common. There is, I mean, there is still a stigma, but
not like before.
Not like before. So it can prevent you for a lot of things.
Yeah, so I mean, ultimately, the people that end up coming to us, most of the time, they're people that need some sort of intervention.
Yes.
And that makes sense. And, you know, I think it's 1 in 3 or 1 in 4 people are going to experience some kind of mental health issue or challenge over the course of their lives. So it happens, and there are ways through it. At the same time, what I'm hearing from you is we have so much power as individuals to be able to make changes without this intervention, but we can't do that without reflection and identification, right?
Exactly. Yeah. Without that, I mean, we cannot force anybody to go to psychotherapy, but that would be the most important part, to have a moment with yourself and try to reflect and think about other alternatives. That's why going through pain opens new insights. That's the positive part of going through pain.
Okay, so 2 things I want to talk to you about. Number 1 is, you know, maybe we can invite everybody that's listening to this now to think about some of the things that they do, whether it's the substance use, whether it's the social media use, whether it's the eating behavior, whether it's overworking. So think about what you do and think about what purpose it's serving. Also, think about what danger or problem it might be bringing to you on an emotional, psychological, social level, and so on. Now, the other thing I really want to pick your brain about is the idea of pain having a function.
Yes, it has a function. That's why we don't have to escape from pain, because going through pain makes you learn about different things about yourself and also about life, and also helps you grow as a person. Like people, I mean, I have seen so many patients that maybe they were 55 years old, and I could say I was talking to a teenager because they've been escaping from everything in their life. But maybe in Colombia, I talked to a guy who was 70 years old, and he went through so many difficult moments. He faced these situations. He validated everything, obviously with help. But I could tell that I was talking to an adult who was, who growed about after all these difficult moments. So, yeah, pain has its positive part.
It has its information, right? And I mean, on a physical health level, if we didn't experience pain, that would be really problematic and very dangerous for us, right? It would probably contribute to us not seeking treatment for something that is detrimental to our physical health. And it sounds like it's the same thing when it comes to mental and psychological health. Pain alerts us to things. Maybe it's things that are unprocessed. Maybe it's a way to make meaning about who we are, what is important to us. And this can be, rather than this idea of, okay, well, why would I want to feel bad? And feeling bad just makes me a negative person. It paves the way to, I will know myself better, and there's a place for me to grow and to develop.
Yes, exactly. And it also gives you resilience for life, and you get to experience more interesting experiences in life. Because, you know, sometimes people, they are very afraid of, I don't know, starting a new relationship. They are afraid of suffering, etc. But when you go through pain and you know that you learn, you grow, and you can overcome that pain, it's when you are prepared to live.
Well, and you just brought up something else, which is, you know, there is the experience or the beginning of experiencing pain and suffering, and then we numb ourselves. But what you're describing now with the relationship is that some people will avoid putting themselves in a position to experience that pain. With the example of a relationship, maybe I've been hurt so many times in my romantic relationships, I really don't want to deal with that again. So yes, maybe I numb, but maybe the best way for me to do that is to just say, I'm going to be single for the rest of my life. And that might help in terms of, okay, fine, I'm not going to have my heart broken again. But there's an opportunity cost. I won't experience love.
Exactly. You will miss that opportunity, which is also very nice to experience and to go through. So yeah, that would be a super good example. Yeah.
And there's risk that we have to take, right? When it comes to experiencing amazing things. There's that trade-off.
Yeah.
Risk
and I
and
know,
reward.
yes, I know it's difficult, but that's life.
Yeah. Okay. Well, thank you so much for all of your time and your insights today about the Palliative Society, what you've been observing, what I can say we've also been observing in terms of people avoiding and escaping their pain through the use of many different tools. It was helpful to hear from you the difference between psychiatry and psychotherapy, how they work hand in hand, and how through evaluation, interview, consultation, we can assist. But even beyond that, it's not just about bringing everybody in the door to sit with a psychiatrist and a psychotherapist. There are a lot of things that can be done preventatively or early in order to recognize our problematic patterns and try to avoid, you know, having them develop into something more significant.
Yeah, exactly.
Yeah. Okay. Thank you again for your time. And as I said at the beginning of the episode, you're with us at Thrive. So if anyone wants to learn more about the work that you do there as a specialist psychiatrist, they can visit our website.
Okay. Thank you for the invitation.
Thank you.